Where's your appendix? Do you need it? Appendix is a 3.5-inch long tube of tissue extends from your large intestine on the lower right side of your body. The appendix has specialized tissue that can make antibodies, but no one is completely sure what its function is. Appendicitis is inflammation of the appendix. The appendix is a closed-ended, narrow, worm-like tube up to several inches in length that attaches to the cecum, the first part of the colon. The anatomical name for the appendix, vermiform appendix, means worm-like appendage. The inner lining of the appendix produces a small amount of mucus that flows through the open central core of the appendix and into the cecum. The wall of the appendix contains lymphatic tissue that is part of the immune system. Like the rest of the colon, the wall of the appendix also contains a layer of muscle, but the layer of muscle is poorly developed. It is not clear if the appendix has an important role in the body in older children and adults. In young children, it may have an immune function. There are no major, long-term health problems resulting from removing the appendix, although a slight increase in some diseases has been noted, for example, Crohn's disease. Appendicitis causes pain in your lower right abdomen. However, in most people, pain begins around the navel and then moves. As inflammation worsens, appendicitis pain typically increases and eventually becomes severe. Although anyone can develop appendicitis, most often it occurs in people between the ages of 10 and 30. Standard treatment is surgical removal of the appendix. Acute appendicitis is a severe and sudden case of appendicitis. It's most common in children and young adults between the ages 10 and 30 years old and occurs more frequently in males than females. Pain tends to develop and intensify quickly over the course of 24 hours. It requires immediate medical treatment. If left untreated, it can cause your appendix to rupture. This can be a serious and even fatal complication. Acute appendicitis is more common than chronic appendicitis, occurring in about 7 to 9% of all Americans in their lifetime. Chronic appendicitis is less common than acute appendicitis. It occurs in only about 1.5% of all people who have already had a case of chronic appendicitis. In chronic cases of appendicitis, the symptoms may be relatively mild and are thought to usually occur following a case of acute appendicitis. Symptoms may disappear before reappearing again over a period of weeks, months, or even years. This type of appendicitis can be challenging to diagnose. Sometimes it's not diagnosed until it develops into acute appendicitis. Chronic appendicitis can be dangerous. What causes appendicitis? Although it can strike at any age, appendicitis is rare in children younger than 2. Appendicitis happens when the appendix gets blocked, often by poop, a foreign body, or cancer. Role of infection. Blockage may also result from infection, since the appendix can swell in response to any infection in the body. It's not clear what brings on appendicitis. Something triggers an inflammation, irritation and swelling, or infection in your appendix. Causes could include 1. Abdominal injury or trauma. 2. Blockage at the opening where the appendix connects to the intestines. 3. Digestive tract infection. 4. Inflammatory bowel disease. 5. Growths inside the appendix. Signs and symptoms of appendicitis may include 1. Sudden pain that begins on the right side of the lower abdomen. 2. Sudden pain that begins around your navel and often shifts to your lower right abdomen. 3. Pain that worsens if you cough, walk or make other jarring movements. 4. Nausea and vomiting. 5. Loss of appetite. 6. Low-grade fever that may worsen as the illness progresses. 7. Constipation or diarrhea. 8. Abdominal bloating. 9. Flatulence. The site of your pain may vary, depending on your age and the position of your appendix. When you're pregnant, the pain may seem to come from your upper abdomen because your appendix is higher during pregnancy. Symptoms of chronic appendicitis. The symptoms of chronic appendicitis may be mild. 1. In some cases, abdominal pain is the only symptom with chronic appendicitis. The pain is usually in the lower right side of the abdomen. It may also appear near the belly button and move to the lower right side of the stomach in some cases. The pain can vary from sharp to dull, but it's more common for it to be dull. Other symptoms of chronic appendicitis include 2. Abdominal pain. 3. Fever. 4. Abdominal swelling and tenderness. 5. Fatigue or lethargy, which is a lack of energy. 6. Malaise, which is a general feeling of discomfort or illness. 6. Some people might also experience nausea or diarrhea. Symptoms may come and go, which can make the condition more difficult to diagnose. If you have any of these symptoms and they continue to become more severe, consider going to the doctor. They may be a sign of a serious medical problem. What are the complications of appendicitis? 1. If it isn't treated, a diseased appendix can rupture. A burst appendix can cause an infection that can lead to serious illness and even death. Complications include 2. Abscess. You may develop an appendicular abscess, or a pocket of infectious pus. Your doctor will place drainage tubes in your abdomen. These tubes remove fluid from the abscess before surgery. The drainage process may take a week or longer. During this time, you take antibiotics to fight infection. After the abscess is gone, you'll have surgery to remove the appendix. 3. Abdominal infection. Peritonitis can be life-threatening if infection spreads throughout the abdomen. Abdominal surgery, laparotomy, removes the ruptured appendix and treats the infection. 4. Sepsis. Bacteria from a ruptured appendix can get into your bloodstream. Sepsis. If it does, it can cause a serious condition called sepsis. Sepsis causes widespread inflammation in many of your organs. It can be fatal. It requires hospital treatment with strong antibiotics. How can I prevent appendicitis? There's no proven way to prevent appendicitis. Eating a high-fiber diet with lots of whole grains and fresh fruits and vegetables may help, although experts can't explain why. Although more research is needed on the potential role of diet, appendicitis is less common in countries where people eat high-fiber diets. Foods that are high in fiber include 1. Fruits, 2. Vegetables, 3. Lentils, 4. Split peas, 5. Beans, and other legumes. 5. Oatmeal, 7. Brown rice, 8. Whole wheat, and other whole grains. Your doctor may also encourage you to take a fiber supplement. Add fiber by sprinkling oat bran or wheat germ over breakfast cereals, yogurt, and salads. Cooking or baking with whole wheat flour whenever possible. Swapping white rice for brown rice. Adding kidney beans or other legumes to salads, eating fresh fruit for dessert. How is appendicitis diagnosed? 1. The diagnosis of appendicitis begins with a thorough history and physical examination. Patients often have an elevated temperature, and there usually will be moderate to severe tenderness in the right lower abdomen when the doctor pushes there. If inflammation has spread to the peritoneum, there is frequently rebound tenderness. Rebound tenderness is pain that is worse when the doctor quickly releases his or her hand after gently pressing on the abdomen over the area of tenderness. It is due to the sudden rebound of the peritoneum after it has been deformed by finger pressure. 2. White blood cell count. The white blood cell count usually becomes elevated with infection. In early appendicitis, before infection sets in, it can be normal, but most often there is at least a mild elevation even early in the process. Unfortunately, appendicitis is not the only condition that causes elevated white blood cell counts. Almost any infection or inflammation can cause the count to be abnormally high. Therefore, an elevated white blood cell count alone cannot be used to confirm a diagnosis of appendicitis. 3. Urinalysis is a microscopic examination of the urine that detects red blood cells, white blood cells, and bacteria in the urine. Urinalysis usually is abnormal when there is inflammation or stones in the kidneys or bladder. The urinalysis also may be abnormal with appendicitis because the appendix lies near the ureter and bladder. If the inflammation of appendicitis is great enough, it can spread to the ureter and bladder, leading to an abnormal urinalysis. Most patients with appendicitis, however, have a normal urinalysis. Therefore, a normal urinalysis suggests appendicitis more than a urinary tract problem. Barium enema. 4. A barium enema is an X-ray test in which liquid barium is inserted into the colon from the anus to fill the colon. This test can, at times, show an impression on the colon in the area of the appendix where the inflammation from the adjacent inflammation impinges on the colon. barium enema also can exclude other intestinal problems that mimic appendicitis, for example Crohn's disease. 5. You also may have an imaging scan. Any of these tests can show signs of blockage, inflammation or organ rupture. Computed tomography, CT, scans show cross-sections of the body. They use a combination of X-rays and computer technology. 6. Magnetic resonance imaging, MRI, uses radio waves and magnets to produce detailed images of abdominal organs. 7. An abdominal ultrasound uses high-frequency sound waves to show images of organs. How is appendicitis treated? Most people with appendicitis need a surgery called an appendectomy. It removes a diseased appendix. If the appendix hasn't yet ruptured, surgery prevents that rupture and keeps infection from spreading. Before surgery, you receive intravenous 4 antibiotics to treat infection. Some cases of mild appendicitis get better with antibiotics alone. Your doctor will watch you closely to determine if you need surgery. Surgery is the only way to treat abdominal infection when the appendix ruptures. If you need surgery, most appendectomies are done laparoscopically. Laparoscopic procedures take place with a scope through small incisions. This minimally invasive approach helps you heal faster, with less pain. You may need major abdominal surgery, laparotomy, if the appendix ruptures. What is an appendectomy, surgery? Appendectomy procedure. To remove the appendix, the surgeon separates it from the mesentery, which is the tissue that delivers blood to the area. During an appendectomy, an incision 2 to 3 inches in length is made through the skin and the layers of the abdominal wall over the area of the appendix. The surgeon enters the abdomen and looks for the appendix, which usually is in the right lower abdomen. After examining the area around the appendix to be certain that no additional problem is present, the appendix is removed. This is done by freeing the appendix from its mesenteric attachment to the colon, cutting the appendix from the colon, and sewing over the hole in the colon. If an abscess is present, the pus can be drained with drains that pass from the abscess and out through the skin. The abdominal incision then is closed. New techniques for removing the appendix involve the use of the laparoscope. The laparoscope is a thin telescope attached to a video camera that allows the surgeon to inspect the inside of the abdomen through a small puncture wound, instead of a larger incision. If appendicitis is found, the appendix can be removed with special instruments that can be passed into the abdomen, just like the laparoscope, through small puncture wounds. The benefits of the laparoscopic technique include less post-operative pain, since much of the post-surgery pain comes from the incisions, and a speedier return to normal activities. An additional advantage of laparoscopy is that it allows the surgeon to look inside the abdomen to make a clear diagnosis in cases in which the diagnosis of appendicitis is in doubt. For example, laparoscopy is especially helpful for menstruating women in whom a rupture of an ovarian cyst may mimic appendicitis. Recovery from surgery. If the appendix is not ruptured, perforated, at the time of surgery, the patient generally is sent home from the hospital after surgery in 1 or 2 days. Patients whose appendix has perforated are sicker than patients without perforation. Their hospital stay often is prolonged, 4 to 7 days, particularly if peritonitis has occurred. Intravenous antibiotics are given in the hospital to fight infection and assist in resolving any abscess. Occasionally, the surgeon may find a normal-appearing appendix and no other cause for the patient's problem. In this situation, the surgeon will usually remove the appendix. The reasoning in these cases is that it is better to remove a normal-appearing appendix than to miss, and not treat appropriately, an early or mild case of appendicitis. In addition, if patients have appendicitis-like pain again, the doctor will know that the appendix has been removed, and the diagnosis of appendicitis is not possible. What is the recovery time for an appendectomy, surgery? Recovery from an appendectomy depends on the severity of the inflammation. If inflammation is mild, recovery can take a few days to a week. If there has been more extensive inflammation such as an abscess or localized perforation of the appendix, recovery might take several weeks. Free rupture of the appendix into the peritoneal cavity, abdomen, may require even longer. Recovery has become much faster with the substitution of laparoscopic for open surgery. What is confined appendicitis? There is a small group of patients in whom the inflammation and infection of appendicitis remain mild and localized to a small area. The body is able not only to contain the inflammation and infection but to resolve them as well. These patients usually are not very ill and improve during several days of observation. This type of appendicitis is referred to as confined appendicitis and may be treated with antibiotics alone. The appendix may or may not be removed later. There is still some controversy, however, about leaving the healed appendix in place since appendicitis can recur. What is stump appendicitis? When the appendix is removed surgically, a small portion may be left behind. This piece of appendix may become inflamed and is prone to develop all of the complications of appendicitis. Thus, it is possible for individuals who have had their appendix removed to develop another episode of appendicitis. Stump appendicitis is treated similarly to appendicitis with an intact, surgically unremoved, appendix. It is important to consider early and diagnose stump appendicitis since inadequate diagnosis and treatment can result in a rupture of the inflamed stump. What are the complications of appendicitis? Can they be life-threatening? The most frequent complication of appendicitis is perforation. Perforation of the appendix can lead to a periappendiceal abscess, a collection of infected pus, or diffuse peritonitis, infection of the entire lining of the abdomen and the pelvis. Appendiceal perforation. The major reason for appendiceal perforation is delay in diagnosis and treatment. In general, the longer the delay between diagnosis and surgery, the more likely is perforation. The risk of perforation 36 hours after the onset of symptoms is at least 15%. Therefore, once appendicitis is diagnosed, surgery should be done without unnecessary delay if the patient does not improve with antibiotics alone. A less common complication of appendicitis is blockage or obstruction of the intestine. Blockage occurs when the inflammation surrounding the appendix compresses the intestine, and this prevents the intestinal contents from passing. If the intestine above the blockage begins to fill with liquid and gas, the abdomen distends, and greater nausea and vomiting may occur. It then may be necessary to drain the contents of the intestine through a tube passed through the nose and esophagus and into the stomach and intestine. A feared complication of appendicitis is sepsis, a condition in which infecting bacteria enter the blood and travel to other parts of the body. This is a very serious, even life-threatening complication. Fortunately, it occurs infrequently. Which specialties of doctors treat appendicitis? A person with appendicitis may be seen first by family practitioners, internists, and pediatricians. However, usually the person is evaluated by a general or another type of surgeon. Once appendicitis is suspected, a general surgeon always is consulted in case surgery is necessary. What other conditions can mimic appendicitis? The surgeon faced with a patient suspected of having appendicitis always must consider and look for other conditions that can mimic appendicitis. Among the conditions that mimic appendicitis are: 1. Meckel's diverticulitis. A Meckel's diverticulum is a small outpouching of the small intestine, which usually is located in the right lower abdomen near the appendix. The diverticulum may become inflamed or even perforate, break open or rupture. If inflamed and or perforated, it usually is removed surgically. 2. Pelvic inflammatory disease, PID. The right fallopian tube and ovary lie near the appendix. Sexually active women may contract infectious diseases that involve the tube and ovary. Usually, antibiotic therapy is sufficient treatment, and surgical removal of the tube and ovary are not necessary. 3. Inflammatory diseases of the right upper abdomen. Fluids from the right upper abdomen may drain into the lower abdomen where they stimulate inflammation and mimic appendicitis. Such fluids may come from a perforated duodenal ulcer, gallbladder disease, or inflammatory diseases of the liver, for example, a liver abscess. 4. Right-sided diverticulitis. Although most diverticuli are located on the left side of the colon, they occasionally occur on the right side. When a right-sided diverticulum ruptures, it can provoke inflammation that mimics appendicitis. 5. Kidney diseases. The right kidney is close enough to the appendix that inflammatory problems in the kidney, for example, an abscess, can mimic appendicitis. 6. Ectopic pregnancy. It is usually as easy to differentiate between a normal intrauterine pregnancy and ectopic. When the fetus is implanted in the fallopian tube or elsewhere instead of the uterus, the symptoms may mimic appendicitis.